lights out.
Perfect.
That's what they just said, some 4 o'clock update for the states out.
Mm.
Oh, it's Wednesday.
We are live.
I think everybody's ready to go. I'd like to call this meeting to order. Good afternoon, everybody. This is the Thursday, April 16th, 2020 Board of Health meeting. Just like to remind everybody that this meeting is being recorded by video and audio. And the governor has given us permission to do all these meetings remotely. That is also attached to the agenda if anybody wanted to read it. Since we're not going to have any public comment, we'll go by that. I'll turn this over to Roberto with the COVID update.
So just to give a quick overview for the COVID update, I'm looking at the agenda right now. We're going to be having a discussion later today about the work plans, so that's later. So I'm just going to skip that for now. But what we've been looking at, just as a quick update, we're still in the midst of our shelter-in-place order or stay-at-home orders. We are now going upon 12 days without cases. The new numbers will come out in an hour. So hopefully we're still doing well. I see Gary nodding, so that's a good sign. But one of the things that I wanted to just take this time to just do a brief commentary on it is that one of the things that we do, the primary thing that we do as the health department and the Board of Health is we look at the health of the island. We take into consideration all the information we have, all the statistics, data, and policy that we have, and try to make the best decisions that we have. Sometimes those decisions don't please everybody. And just know that anyone watching and know that the board here, we get that we're not going to make everyone happy. We get that these decisions aren't always easy. It is really important that people understand that we're trying to do things as thought out as possible. This is a very unprecedented moment in history. The last time the world has seen something like this was over 100 years ago in 1918. This is one of those once in a lifetime, maybe once every 2 lifetimes events. And we do understand that this affects everyone in a very different way, in a hard way. And our decision, it is unfair that these decisions fall on those of us in the leadership in the government. Those are our elected officials, our appointed boards. It is definitely unfair that it falls on them, but those are decisions we have to make. We make the decisions as much as we can, as best we can, with as little time as we got. To put it in perspective, it was brought up to my attention today that typically when we do a septic permit, it can take up to 30 days to get those permits approved. And we're being asked to do emergency orders and implement emergency events on the fly. So it's difficult, and I want to applaud your efforts and the efforts of the select board, the efforts of the Board of Health, the efforts of our governor, and all the work that they're doing. This is not easy, and it is really important that we do our decisions with as best information as we have in mind. I know you're all receiving texts and emails, so are we. Even today, even yesterday, after I spoke at the select board meeting, I received an email telling me to rot in hell. That's just the type of information we're going to get, and we hear you. We hear everyone. We are listening. We are doing the best we can, but bear with us that we are also human as well as you, and that sometimes some mistakes will be made, and we are working as best as we can to do the best information, the best decisions that we have. So other than that, I think we can move on. That's all I wanted to say on the COVID issue.
Thanks. Any other comments or questions for Roberta? Okay, seeing none, we'll move on to the public hearing, regulation 51. So quickly, could I get a motion to open up the public hearing?
So moved.
Second.
So this is the public hearing for Regulation 51, which is the Nantucket regulation. That regulation is obviously very contentious. It's one of those regulations that we were hoping to hear today and have the public comment from everyone as we could. Obviously, we cannot do that. So one of the things that we're asking you to do is to go ahead and table this public hearing to the July 16th meeting, which is 90 days from today, or 3 months from today. And we should be in the relative back to normal stages at that time. So having a full public hearing right now would be unfair to the public who is affected by this regulation. So we are asking that we table until July 16th at 4 p.m.
I would make that motion.
Second.
It looks like we lost Steve.
The chair.
So Malcolm, would you mind taking over as chair until we can get Steve back?
We have a motion and a second to delay or table a public hearing on 51 until July. Any further discussion? All in favor, say aye or raise your hand.
Aye.
I'll do a roll call. Helene,
Aye.
James,
James, you're muted.
Rita,
Aye.
James,
Aye.
motion is carried.
Okay. I think the next item on the agenda. I think the next item on the agenda right now is the review of the minutes. So if you have all taken a chance to take a look at the minutes, I think we can vote them all as one large lump.
Any comments on, we had 2 minutes, we had a whole bunch there. Any comments on the minutes, corrections, additions? I have a motion for approval of the minutes.
I make
So
it.
moved.
Second.
Further discussion? Helene,
Yeah, aye.
James,
Aye.
Rita,
Aye.
minutes are approved.
Okay. So the next
We have some loans or whatever.
3 items are the 3 loans, septic repair loans. Obviously, we're trying to process these administratively so that we have them ready for when we do get the moratoriums lifted. One of the things that we were wondering if we can just go ahead and lump all 3 together. There is no objection from the staff.
Any objection to lumping them all together? By unanimous consent, we'll lump them together, Roberto.
Perfect. So the 3 properties are 53 Millbrook Road, 266 Nantucket, and 30 Dukes. 2 of them are septic repair, and the Dukes is to connect to sewer.
Do I hear a motion?
I make a motion to approve.
Second.
Any further discussion? Vote will commence. Helene,
Aye.
James,
Aye.
Rita,
Aye.
chairman votes aye.
Perfect. Then we administratively tabled the variance requests for the septic systems. So I guess we're going over to the genetic mice steering committee appointment. We had a person step down from the genetic mice project as a steering committee. So we have recruited Ginger Andrews to take that.
Ginger Andrews, remember you gave me the authority to a sense to appoint, but I still want unanimous consent. I think you know Ginger, she's an ornithologist. She was on the Conservation Commission. She's now on the Shellfish Advisory Board. She's certainly a well-known Nantucketer, and she certainly cares about the environment. So we wanted to make sure we had someone on the committee besides a bunch of stuffy scientists. So I ask for any comments on Ginger's appointment. Hearing none. I'd someone make a motion to appoint her, please.
So moved.
Second.
Further discussion?
Second.
Elaine,
Aye.
James,
Aye.
Rita,
Aye.
Chairman votes aye. Ginger, if you're listening, welcome to the committee. Obviously, our MIT scientists are all at home. So like everything else in the world, I think we always knew this would be a long project. It's going to be a lot longer.
Oh, Stephen. So,
Sorry about that.
Oh, welcome back.
Yeah, we got a lot of computers on this Wi-Fi.
okay,
That's
so
fine.
we
You're the
we
chairman.
we actually just finished the genetic mice project, so we're moving straight to the phased work plan. So you came back just in time.
Okay, how about the public hearing? Did you do that and close?
Yes, we moved it to July 16th at 4 p.m.
All right, great. Sorry about that. So I guess we'll move right to the phase work plan.
Okay. So you should have the drafts in your emails. The most recent ones, I believe, were sent a little bit over an hour ago. These are for the landscape and construction plan that was discussed yesterday at the select board meeting. We have a representative from the select board, two representatives from the select boards here today to answer any questions. And there is a joint Board of Health Select Board meeting tomorrow at 1 p.m. One of the things that we will also look to discuss at that meeting for tomorrow, you may find in your email that just about an hour ago, we sent a draft of an emergency order as well to require masks for essential services like Stop and Shop for the workers, the employees. So that's something that we'll be taking up tomorrow as well. And I think, Don, I believe I forwarded it to you as well, but if you don't have it, I'll get that to you in just a little bit. And then I guess we can go ahead and start with any questions that you have on any of these two drafts. Know that we have that meeting for tomorrow as well. So any of the things that you would like to see, anything changed, any suggestions, any comments, I think now is a good time to put it, but if you need more time to digest it, we do still have the meeting scheduled for tomorrow at 1. So that's
Anybody want to start? Malcolm?
Well, one thing that has been discussed, swimming pools. Do we need swimming pools right now?
well, when you say swimming pools, do you mean opening up the semi-publics, or do you mean construction?
Well, I have to admit, it just came and I skimmed it. I just saw the word swimming pool in there, and it kind of raised my,
It was maintenance of swimming pools.
Yeah, so there are some maintenance duties that come with the swimming pools. I believe right now we're not, with the shelter-in-place order and things like that, it's not they're not open yet. But we're heading into the season where swimming pools that don't have their filters on, they've been laying stagnant for a while. They're starting to get their algae blooms going in, and then we start seeing the mosquito issues. So what they're looking to do is to make sure that the maintenance is going on so that things don't get fully damaged. There's no reason to allow that sort of stuff to lie, like the pumps to lie fallow, for example. So it is the maintenance of the swimming pools, but not opening new ones or building new ones right now, unless they're in that last few steps of it where you can do it as 1 or 2 people working on it.
Yeah, that was my question, is it can be done by 1 or 2 people?
Some
Yeah.
of it can, yes. But obviously putting in a whole new pool, requires an excavator crew and a whole 9 yards. But if you're already at the last few minutes where you're doing the last few steps where you're doing acid washes or things like that, that's a lot easier.
Okay. And do we have a recommended, I'm sorry, do we have recommended timing when this would start?
Really, as of right now, the governor's order expires on May 4th. It is up to the board, you guys, to set the time on when you want this to come in. Some of the dates that are being thrown around are, the April 24th, April 27th timeline, which is next Friday, or the Monday after. It gives us this week to start gearing up and getting these lists of projects and things together. But it is entirely up to the board on the date.
Just to follow up with that, does Gary or the health officer or the professionals, would they recommend a date?
Harry?
Yeah, can you hear me?
Yes.
I want you to feel confident that the tools that we need in place to help monitor the situation, whatever that is that you allow, that we have the ability to screen, and we can rapid cycle screening if we need to do a lot of it. Now that's screening at a drive-through, and it's not doing or opening up just open testing to the public. That's not available yet. So we would have that tool. We have the ability to quarantine, obviously, and we've trained more than 26 individuals to do contact tracing here to augment the staff that Roberto has. And they're essentially going to be deployed at his demand. They're really to help him when we have some individual or families that we want to quarantine. So I believe you have the tools here at the Cottage Hospital. We have no COVID patients in the hospital. And actually, we should have some. We should have some to be able to help us navigate. If I could use an analogy, we have this fire hose over on the coast that's been going on in both towns, New York and Boston. And what we're going to be doing in this test is trying to take a cup of water out of that fire hose and see what's in it, and then learn how to navigate coming up to a new norm and what's possible in navigating behaviors, what's possible in navigating disease that we have coming. So from my perspective, we're ready now. The question is, how fast can you tool up, to do lift the brakes a little bit, and then let's test it and see. So the choice is yours. We're here to support you. You're on mute, Malcolm?
Malcolm.
It's okay.
When we're done with this discussion on the order, I have a question about testing for you when we're done. Don't let me forget.
Annie?
Given the amount of paperwork that's going to be necessary to generate and be filled out, would the 27th be the best date to implement the program?
We can definitely work on the 27th. That is a Monday. It's a nice start date. I know it's a lot. There's a lot of information in those two work plans. If you want to take time to digest it, if you have any questions, we can definitely go back. If you want any additions, any subtractions in it, I know there's still things being discussed even now among the staff. We received the most recent update just a few minutes before the meeting. So there's definitely, it's a living document as of right now. And town council is working as hard as they can to finalize it for you. So once it is final, and we can definitely set a start date. I believe we can set a start date even today. We just need to, the board would need to vote in or vote to table, vote to implement it, vote to augment it, or even just by consensus, we can look to add or subtract any portions of it. I know Rita had some questions on the landscaping portion of it yesterday. I don't know if you want to ask anything now, or we can discuss anything now while we have it. I know, Dawn is here if you have any questions. And then we always have the meeting tomorrow as well.
Mhm.
Excuse me.
Jimmy, yeah.
Are we at this meeting, we're gonna try to see how we're gonna let people go back to work? Or are we gonna wait to discuss all that and work it out tomorrow with the Board of Selectmen?
You can have that discussion now.
All right, I have, in reference to what the chief said yesterday, he said the governor said that no empty structures would have water or electricity turned on. And I have a thought about that. And the thing is, let's say you have a family, a wife and a husband and 3 kids that have their house that have been in Florida for 2 months. The water's off, they come back and they're on the boat. When they come on the boat, they're gonna be asked to quarantine themselves at home for 14 days. So if they go home to an empty house and they get in the empty house, the next thing you have is you have an emergency because you have a family living with no water, no heat, and nothing. So my thought was, why, when that house is completely empty now, why wouldn't you allow a plumber to go in, turn the water on, turn the heat on, turn the valve on if there's a sprinkler system for outside that house, turn everything on inside that house. And if there's an electrician needs to do anything to the heat or anything, let them do that while the house is empty and they have no chance of mingling with any other people. So if the people get off the boat, the family gets off the boat and they're told to quarantine, they can go to their house is open, they have heat, they have water, they have everything. No one has actually mingled with each other to get the virus, and you wouldn't have an emergency on your hand.
That's definitely something we can add to the order.
Gary?
Mhm.
Gary?
Something to keep in mind here is that the Select Board and the Board of Health supported extremely fast a request from the Cottage Hospital to take measures to slow down the spread of COVID. And so we actually, as a town, as a community, reacted way ahead of where the state was. We took that measure because it was unique to this environment, and then the state followed as it started to see its own incidents pick up. Now we're way ahead of the state, and the state's mandate is still to provide protections to the entire state, but we're a pocket that's ahead of where they are by a couple of weeks. I'm wondering if there's not an option for the Board of Health to do what you did when you went beyond the governor's orders to go ahead and allow, under the Board of Health venue, to your point, James, an order which allows that to have water turned on so that you don't create another public health issue with the return of people, as you mentioned. I think that's something to consider. I just don't know what your authorities are.
Let me start with Dawn first. She had her hand up.
I thought that we kind of settled the discussion on that yesterday in terms of the definition of unoccupied, that if it's a CO'd house kind of thing, well, I mean, maybe not even necessarily CO, if it's a completely finished house that has furniture in it that's been occupied, just because someone's gone for a period of time doesn't necessarily render it completely unoccupied. And I thought that the general consensus was that that it's better to have the work done before it becomes occupied and becomes more of an emergency situation, as well as under the governor's order, which is a little bit different than the stay-at-home order that we'd initially done, that we're now under. Caretaking services are allowed and property management services. So I think that we kind of came to the conclusion that those things are okay. And I just don't think the message has been fully out there because it's different than the original message that was put out.
Yeah.
And I mean, one thing that maybe we want to discuss a little bit more in regard to the construction piece, I'm getting a lot of questions as to and I don't want to confuse this because I think we're in a really good spot with the construction. If you guys want to go back to any kind of consideration about the kind of independent one worker on some of these small jobs, and in addition to the things that we've got in there. but having the right parameters on it, some kind of an application process.
Right. Can I just make a comment on exactly what you just said? And we did just get this a little while ago, and it's a lot to go over, but I've been bringing up the same thing to people that have talked to me, is this set of rules for, landscapers in their own category, when in fact, most Nantucketers here, year-rounders, are self-employed individual people. They encompass a lot more people than the landscapers. And, back to what Gary said, one person out in the, at an unoccupied house doing something, whether it's a painter, an electrician, a tile guy, an HVAC guy. There's, besides the landscapers working for all these people, these individual people are working for the same clients. It's a little discriminatory, I think, in the wording. So I think you get a big backlash without doing something for these individual people, and then doing something for the landscapers right away in this phase one. I'd just like to, that's all I wanted to say about that. I had a lot of comments and people calling me today about that. Rita?
Yeah, I just wanted to comment on the water, and it was something that had come up yesterday. I think it's been a little bit of a tricky conversation, but it does seem like it is, I do think, and the board discussed that it's safer for people to be doing that in an unoccupied house now than a situation like James painted later on. Or, again, I think that it's a conversation that we will have to have at some point about what it looks like when more people start coming back to the island, but not turning on water as a backdoor way of basically making it difficult for people to come back home, I think, or come back home maybe, or come back to the island. So, and the board also discussed last night that it is difficult to differentiate between someone who left for 1 month, 2 months, or 6 months and had their water shut off, so that there isn't really an equitable way to decide who gets their water turned on and turned off. Skipping ahead just for a moment to the landscape side, speaking to some of the irrigation guys, it's also another part of the landscaping when we're talking about what's, Gary mentioned last night, what can we ferret out that can be a safe place to start where social distancing can be practiced. And irrigation can be turned on with one person. When it's two people, it's often they have walkie-talkies and they're in two very different locations. So, I think the water element is one that can be looked at for building and construction. I also think that the water is probably part of the getting landscapers back to work, having running water on properties to wash their hands when they need to be able to do that. So I do think the water is one that we should look at allowing. And just quickly, on the one person per job site or work site, I think that's something that I've been thinking about, and Jeff Carlson and I discussed about landscaping and looking at what phase one looks like. But I think in terms of construction, I think it is possible and we were concerned about some of the loopholes. I'd like to have a discussion about what those loopholes were and if we felt we could close them. It seemed what started to come up was this idea of a rapid changeover of trades where it's one guy per job site, but you've got the tile guy for 2 hours, and then you've got the plumber coming in for 1 hour, and then you've got another guy coming in. And if there's a way to make that part of our protocol so that, within a day, one person is there. So those are just some thoughts initially.
Yeah.
I think that the approach you take with the lowest risk are those that Rita and Steve just mentioned. That's where an opportunity exists to let those folks get back into let the brakes off of that, and then let's see where it goes. There's extremely low risk with that, in my opinion, and we've got the ability, here at the hospital, if we see something creeping up, working with Roberto to stay on top of it. I think that's really a great approach, a sound approach, and see where it heads. I know you've got a lot to talk about on the loopholes, but I would agree with what's been said.
So,
Any other
James,
comments?
I think that answered the question about the water, I hope.
Yeah, right, yeah. Since I think the other, I'm just going to speak for myself, but I think I'd like a little time to read this over tonight before tomorrow's meeting, and it's a lot to digest and read. So I just got it this afternoon before we came on. So I'm not sure how the rest of the board members feel. Don?
Do you guys think that maybe you could, as you digest it tonight, shoot comments over to Roberto so that, potentially this could have some revisions or proposed revisions, but that we could see before our meeting at 1 tomorrow, so that we have a really good discussion.
Makes sense.
I've had a little more time to read through and digest, and I really do, I voiced my comments and concerns last night. Gary had some good points as well. I really do want to hear what other Board of Health members have to say before necessarily launching into some of my concerns again. But one of the things that has come up is that, I think inevitably we are going back to work in some way, shape, or form. Personally, I think considering closely what's essential and what can be done safely, and looking at a stepped approach to that, more so I feel than what I've seen in the initial draft. But again, I look to other board members to also share in this sort of judgment call of what is too cautious and what is sort of taking off the brakes lightly. But one of the things that has come up is that there's a divide between business owners, employees, from some of the messages that I've been receiving. And many business owners want to just get going, and there's many employees, a mix of those on unemployment, not unemployment. And again, the select board is trying to balance this economic health with the physical health. But I would like to know possibly if there's any opportunity for some kind of employee hotline. I think employees are concerned that they're going to be forced to go back to work, and if they don't, they'll lose their job. They don't feel safe. And I feel if there was an opportunity for there to be some sort of hotline where if they don't feel like their employers are following safe protocol, that they can make the phone call. One of my biggest concerns with the landscaping side is just there's a lot of us, and we're at a lot of properties in one day, and it's going to be difficult to enforce. And last night, I think some of my comments were taken very personally. I'm actually looking at this just very realistically. And I think when you look at it realistically, you have a better chance of judging the level of risk. And there's going to be some risk. There's risk there. And we just have to decide what is an acceptable amount of risk and what ways we can mitigate it. So I think being realistic about our ability to enforce this informs how much risk we're going to take.
Yeah, that's true. And, I'm going to go back to what Gary said yesterday more than once was, nobody wants to be ill or sick. And from what I see out there and talking to many people with my phone blowing up, is people are going to do what they need to do to stay safe for themselves, for their employees, for their families. It's just what we're going to do here in Nantucket. We're a resilient community, and we want to keep everybody safe. Gary?
Yeah, if I could suggest maybe as you look at loosening those brakes so that we can help folks understand consistently what we think safe is, I think there should be an opportunity, if I haven't already heard it talked about, to develop a fact sheet that we would want to have people have that would help them understand what a good expectation is and what healthy could be. A very simple fact sheet that we'd be happy to help generate with Roberto to give that education. Folks are going to ask, and this is the time to make sure we can get that word out consistently. Just a recommendation.
Gary, I just have a question. Thanks to the leadership of you and your team, obviously the mitigation has been very successful. And I think it's safe to assume that we know as more people come on the island, we will be seeing more positive cases. Is there a specific number of positive cases, or would you be looking at a trend before we might possibly have to go into a semi or a full shutdown mode again?
Yeah, that's a great question. So I'll start with this. Like you, we're in virgin territory here. You know, it's something that we're trying to get to the best minds of the United States to help us understand what that new normal is. You couldn't live in a better part of the United States to have MIT, Harvard, the Mass General, Partners Healthcare. I mean, the folks that are doing research and development to help us walk through the questions and the risks, there's phenomenal support. And so, so we're trying to get it right. We're trying to work as we are as a town and a community with the coast to understand, you know, what's the right thing to do. But the reality is we don't know all of what we would hope we could know. If we could look forward 5 years and look back, you know, the knowledge that we would have would be much greater than we do now. So we're not putting a number on what we would want to have come forward. I'll say this too, in that there's much more disease, obviously, on the coastal areas than there is here. And so a good number of people that are going to come over have already been ill and they're already recovered and most likely not shedding virus. And I think we have to remember that that's out there as well as an advantage to us coming forward. What we do want to have in place, though, is the ability to identify where someone's not feeling well, do that quickly, do some testing to see if they're shedding virus, or if they've already been in one employee area, they've tested positive, and they've not yet followed the ACMED CDC guidelines for 2 positive tests 48 hours apart. You know, if they come here, we would do that for them to help them understand where they sit in their disease. So what we're trying to navigate here is we've got this swimming pool over here completely full of stuff that's over on the coast. And we have not even any water in the bottom of our pool. And we're trying to, you know, if you think of that like a lock that a boat's got to go through, we're trying to know how high we can raise that in incremental levels so that we can have this norm go through. And so it's this balance. So I'm not trying to be evasive in any way, but the first thing we want to do is we want to get a cup out of that fire hose to see what we get and how the social norming, how our population works and behaves. And so that's the first piece. That's the first real important piece is we actually have to have some people come here that we can find and test this and look at how well is it working. And then what we want to do at the same time is more and more testing capacity builds nationally, serology and you know, antibody tests that are much more available, maybe even commercially available at some point where if you want it, you can pay for it and get it done. That we're not there yet. But we want to be able to do a study on the island that would allow us to know right now of, let's just say there were 20,000 people on the island. And if we could test for antibodies for all 20,000 people, what would that test tell us related to who's here now that has had the disease because they've had it long enough to develop an antibody? And that takes about, you know, 5 days or so is what I've been told. And so that would tell us then what's circulating in our population. Now that's the first test as we do this reentry. It's only for the people that would be living on the island now, the seasonal residents, not what's coming over. And then in the fall, probably September, October, we do a matching test of the same people to see what impact that had on those that we know here had a particular level of serology and what's over here. What that helps us do as a community is test this theory of what does it take to re-enter a community that's virgin? We think this is a virgin community now. What's it take to re-enter into a normal community? Roberto, before we started the meeting, said, there's an article out that said it's 2022. I think that was, I don't remember which publication. I do recall hearing that. I don't think it's going to take that long if you can do a stepped approach and fill this water up so that we can merge. It takes a test and some time. So antibody testing, screening testing, to quarantine if we need it, to contact tracing, while we do a simultaneous test of everybody on the island at one point. Now, I'm throwing that out there because today at 5 o'clock, we have the resident representatives from the Broad Institute and MIT and the Mass General, scientists, epidemiologists, infectious disease officers, Roberto, Public Health Department. We're all meeting to talk about a test of that, doing a paper blot test, which is basically it's a pinprick and a finger on a piece of material paper that can then be analyzed once it's dried, and we're working to see if we can get that initiated through MIT. It's a study that we're excited about getting going because that is available. But what we have to first do to make that happen, to complement this whole migration theory that we have, is we first have to define the study, which is starting tonight, take it to the research board at the Mass General, which will occur next week, get that approval. And then we can rapidly cycle through following a plan that Roberto and the community would have to help with in identifying draw stations where we can take those tests, what a database looks like, all of those parts and pieces. So we would then be able to use that information to understand the island now. So we're going to work really hard to see if that can be achieved. We've not yet gotten approval for it. Once we have approval, then we'd love to talk more about it, but just know that that's on either end so that we can see where we sit as a community. That's the goal, to get that going quickly. But until then, letting the brakes off in the lowest risk way so that we can get a cup of that water out there, out of that fire hose, and see what's really there. That's what we have to know as a community, or we will never safely re-enter into a new norm. And that's the worry, is we've got to test this. And so it's an odd parameter where you say very strongly, flatten this curve, because we were so worried about it going like this. And now we've basically, knocked snot out of it. And we actually have to have some disease so we can see where we are in society at this point in time. So we've all together as a team done a fabulous job. And I know that's a long answer to your question of, what's a test and how does that work? But does that make sense?
It does, yeah. It does.
Thanks for the question.
Yeah.
I hope I explained it well.
You did.
So I do know that Concom needs this at this same Zoom conference room in 8 minutes.
Yeah.
So I know Malcolm had a question for Gary before we logged off, but I think we're kind of out of time.
I'll just be really quick, and it goes back to the testing. The antibody testing is going to be a while. The original acute testing, there's an awful lot of false negatives. Test wasn't very sensitive. There's now tests, more commercial tests that have been developed as you usually develop a test, like an Abbott test with a 95% sensitivity and almost 100% specificity. What type of tests do you actually do at the hospital? And are you going to get to the point where you would say have one of these commercial tests, you could do it yourself?
Serology, the blood test for the antibodies, those tests are now coming out in mass, and the Mass General has those. And currently, the way that would work, if our clinicians wanted to test that way, they would, I believe, draw blood and then send that off for an analyzer. That will eventually come to us so that we can do that on our analyzer. We don't have that yet. We do have an analyzer called the Cepheid. And the Cepheid allows us to do a 45-minute test, which gives us a high level of specificity. we only have right now enough to do what we've hit the norm of what we've typically done through our drive-throughs. So we've got 30 of those tests on hand, and we see people through the drive-throughs, or we see a worker or a first responder. We've been using it for that, but we do have enough capacity at the Mass General to test more using that analyzer here for those cases that the physicians think meet the clinical trial requirements or meet a requirement, because they're presenting for illness. So we do have the ability now to do tests in 45 minutes. We've just kept the criteria very tight because we've only had so many, but that's coming online much quicker now. The Abbott testing, we have ordered the Abbott testing, and we're in queue with about 100,000 other organizations in the country.
Yeah, they've only made 150,000 of them, so.
Yeah, and so the analyzer itself is in almost every physician office because it's a standalone point of care machine that's been around forever. It's the cartridge that's been developed, which is the hot item.
It's
and
always,
there's only
it's always the ink in the printer, right?
Yeah, yeah, we don't have the right ink yet, but I can tell you that's rapidly generating. So
Okay.
we're getting there. We're not there yet, but I think the hope here is we can screen. And we can actually do a blood blot, paper analyzer for our entire community to get a sense of where we sit with antibodies. That would be an antibody test. But that's not something that we would use clinically today to say you've got antibodies. That's a study type environment versus a clinical type environment that we're working in. Does that answer your question, Malcolm?
Well, I could go on forever, but we have to next time.
Yeah.
Give me a phone call. I'll give my number.
I'll give you a phone call.
Give me a phone
You guys
call.
can chat later. Rita?
Yeah, I have one quick question about, my understanding is that right now there's a health care for all, regardless of insurance. And one of my concerns has been, again, about how we look at our back to work plans, especially within landscaping, is that we've got a particular group of people in the landscaping. There's a lot of people in the landscape community that I'm concerned may be underinsured or not insured, and we're going to be putting them more at risk by having them be sort of really the front line of taking this sip of water. So I just want to make sure that, or to find out if that's going to be a continued policy at the hospital, just to make sure that for the people that are going to be the first out there to be back working, that they're going to be taken care of.
Yeah, one of the reasons that we obtained a rural health clinic license was so that we could offer opportunities for people at much lower cost to come in and be cared for, and also absorb more of the cost of bad debt if there are folks that can't take care of a payment for that. We want everyone to come to us. We are not going to turn anybody away. And so, the care is here, it's available. We want them to come. We want employers to encourage them to come. And so how that policy, nationally works right now with payers, I think will continue into the future as we learn more, but we're open and we want those folks to come here and we'll care for them.
Thanks. And let's, everybody take a look at this tonight. If you've got any comments or you think something isn't in there that doesn't look right, we'll get it to Roberto, and John, we'll be ready, tomorrow morning. I don't know if town council has to review this before our meeting. Not sure. So we're going to get it into their hands, but I'm going to take a good look at it tonight. And if I have anything, I'll send it right to you.
Yeah, council's been pretty quick on the turnaround on this.
Yeah. Does anybody else have any other questions? So can I get a motion to close the meeting?
So moved.
Second. By roll call vote, Malcolm McNair,
Yes.
Colleen Well,
Yes.
Rita Higgins,
Yes.
Jimmy Cooper. Chairman says yes. Thanks to Dawn and Gary, who's I think
Yeah, they both have to just jump off, and Gary and I have to jump off to the next meeting.
Okay.
So,
So
Thank
we'll
you.
see everybody tomorrow.
Okay, thanks.
All right. Bye-bye. Thank you all.
Yeah, see ya.